Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit community-owned hospital. This program is all about providing you information about health issues that either you or a family member may be suffering from. We hope to give you answers to those questions or guide you in a direction where you need to go to get more answers. I hope you'll stay tuned for our show because we've got a great program today. We'll be right back after these messages. Welcome back to Your Health Matters. My guest today is Claire Crum. She's an RN in our cardiovascular cath lab and also a board member for KHI. Thanks for being on the show today,
You're
Claire.
welcome. I'm very happy to be here.
So you first came to Kingman when?
In 1986, moved here, and I've been working in the hospital since then. The intensive care unit was where I started, and then when the first cath lab opened in 1994, I was asked to participate and be a member of the cath lab team, so it was very exciting because it was such a new thing for me, and it's a very different type of nursing, very, very different from what I've been used to. So we had special training to learn how to work in the cath lab and what it involved, and we actually went to Good Samaritan in Phoenix, and then everything has progressed from the beginning. They had a very tiny little room that was, it was a part of the surgery area that was very small, and it was pretty much to see how well this would progress, and it really did. And in 2000 we opened the second cath lab, which we thought was this huge expansive place, and gradually it closed in on us because we became so busy. And then we realized that there was a greater need for more room. So we now have the most beautiful place. We've had people come from elsewhere that visit our hospital, and they just think it's the most beautiful. And it is for me too. To go to work in that area every single day is just so wonderful because it's pleasant, and we have an incredible team. We have radiologic technologists and registered nurses, and everyone works together. We all work as an incredible team. I mean, we put teamwork on the map. We really do.
That's
it's just,
awesome.
It's a wonderful place to work. We all get along.
Dr. Bakari was instrumental, right, in starting the cath labs?
Absolutely, yes, he was. He was, in fact, he took us with him to Phoenix for our training to Good Samaritan. He was on staff there, and he has been instrumental in helping us learn more and do more and expand every bit of our knowledge and expertise. He's been the guiding light to all of us.
Wonderful.
He really has.
Well, and I know, I'm trying to remember when we broke ground on the new cardiovascular center. Do you remember what year that was? Was it 05, 06?
It was in 06 because we moved in 07.
Okay.
Yes.
Because then, and I remember the last year you were in the second cath lab. It was like you did 2,000 procedures in one room in 1 year, and that was just unheard of. I remember when I was still kind of a novice to healthcare at that time, and I would talk to other healthcare, PR folks, and they go, 2,000? How could you do 2,000 in a year in one room? So I don't even know where your numbers are now.
Well, we worked very hard, and the other thing was, knowing that we had a lot of cases to do every day, our turnover in between cases was minimal, because as soon as that case was almost finished, everyone would come in and help, and yet our patients were treated as persons. Our patients were treated very specially. That's the wonderful part of our staff. They put patients at ease. They're lighthearted with them when they can be, and they're serious when they need to be. Everyone takes an opportunity for teaching whenever possible. So I think the patients that come to our cath lab are given the best possible care that they could ever receive. We treat them like our family members.
That's awesome. Well,
we do.
And a lot of times they are, or your neighbors and friends. That's
good and bad.
I know.
It is small town,
right,
we just,
but it is. I tell people all the time that why it is so important that we provide that quality of care, because these are our neighbors and our friends and our family. And
That's true.
Or someone you're going to run into at Walmart next week. So if you don't take good care of them, they're going to let you know.
That's true. That's very true. Yeah.
So our new, the new cath lab, I know you're doing a lot of different procedures. We've had Dr. Dunning on the show before, and he talked about now he's doing more peripheral, easy for me to say, and the interventional. So that's new.
Yes.
So that's been kind of exciting for you too, I would think.
We were used to doing probably 90% cardiac procedures and 10% non-cardiac, meaning the legs, sometimes kidneys, that's pretty rare, sometimes carotid arteries. So vascular work, that's been probably about 10% of our patient population, and now that's a whole different ballgame because we are doing things and fixing things and making a difference. It's just amazing to see. He's so, Dr. Dunning, he's got patience and perseverance, and he is going to fix that. He's going to fix it, and he does.
Yeah,
he does. He fixes the vessels and things. A person that has a clot in their leg, they have a deep vein thrombosis, what it's called. Those patients historically have had their leg swells because the blood flow back to your heart is not what it could or should be, and he is able to remove the clot and restore the circulation, and that person would normally have a swollen leg for the rest of their lives.
Oh, really?
And not anymore.
Wow.
Not anymore. We've done this. I mean, and it's extensive. It's an extensive procedure, and the patient has to stay overnight with a catheter in their leg
to get the
to try to break up the clot.
Oh.
And the next day they come down and it's either broken up, and they'll put a stent up there in a place where we are not used to going.
Right.
We're not used to going. Well, we have put filters in there, but we've never put stents in there. So we're just seeing things. It's tedious work, but the outcome is just phenomenal.
Well, and those are obviously the type, because we weren't doing them here. So in the past, people had to go somewhere else to have it done, and now they're able to stay home.
Exactly.
Which is, I brag about that on the show all the time, that we're more and more bringing in those kinds of services and doctors that allow us to care for those patients here.
And many times our patients that had to go to Phoenix were elderly, and so the patient might have to go to Phoenix on a helicopter or an airplane by themselves without their spouse, who maybe couldn't drive at night or at all.
Right.
So, or if they did and they could go with the patient, they didn't have wheels down there, they couldn't get around, they didn't, and so the support system is here with the patient, where their family is. So it's a really wonderful thing that everything. I mean, so many of our services now. I'm just so proud to work here. I just think it's like the mecca, the medical mecca of this part of the state. Yeah, we have so much wonderful, just wonderful things to offer to the community.
Well, and I think another thing, of course, that's really important with our cath lab is the fact that you're able to do the whole thing all in one step. So someone can come in and have an angiogram done, right? And then what happens if they find a problem?
If the patient has an angiogram done and we find a blockage, we fix it right then and there. We don't send them home and have them come back. Okay. That's a second procedure that we do not. It's not necessary to be done.
Right.
And we will fix it. We have times that if a patient has more than one blockage, they may have their procedure staged. The dye that we use is excreted through the kidneys. So if the kidneys are already somewhat impaired, we don't want to stress it too much.
Right.
So we may have to separate that and do it in two steps or stages. So the patient usually will go home, and they're encouraged to drink a lot of fluids and follow what the doctor orders. And they might come back, and we did one patient today that the same thing. 5 weeks ago we did a procedure, and today we did her second stage.
Okay.
So it wasn't, sometimes it just cannot all be done at one time. But the diagnostic part and the interventional part together, yes.
Right. And I know that there's times when people have had to have it done, they've had it done at other locations, and have ended up, they do the angiogram, and then they have to stitch them up and send them here to have the stent done. So they end up with that two procedures unnecessarily, which puts extra strain on them, their health-wise, but also on their pocketbook, right?
Sure.
I mean,
and every time you enter that blood vessel, I mean, we have very, very low complication rate, thank the Lord. It really, really is. We have excellent outcomes in our patients. But anytime you do that procedure, it's a risk.
Sure.
And so if it should never be done unnecessarily.
Right. I mean, you've got scar tissue issues.
Exactly.
And
exactly.
bleeding.
Exactly.
Yeah, most of these folks already have heart issues. So
exactly.
Yeah. Well, I'm just really, like you, very proud of our hospital and what we're able to do for our patients. And it is about providing the best patient care and still in a quality care as well. And so We have every right to be proud.
I feel in our hospital the patient is at the forefront of everything we do. I know in my department I can honestly say that because you know, and we have nurse advocates in our and no, I shouldn't say they're not just nurses. The rad techs are just awesome too. They will go and get something for a patient. They go outside of their realm. They do extra things, and it really is. It's all about, or the families too. You know, the family might want, would you like a cup of coffee or whatever? They'll make that extra gesture, and they're very grateful for that. They really are. We had a rad tech who actually drove a patient's wife home. He hadn't expected to stay overnight, and I don't know whether she couldn't drive in the dark, but he took her home in his car. I mean, he just things like that are really special, and that's just the way everybody is. It's just we treat the person as we would our own family.
Right.
Yep, we do.
That's awesome.
We do.
I'm proud of that. So you're also on the KHI board.
Yes.
Which is, and are you the only?
I'm the only hospital employee. Well, there are physicians on the board, but yes, I'm the only hospital employee that's on the board.
That's pretty cool.
I'm not on the executive board. I'm not on the executive board. I'm on the general population, but I try to take my day off once a month when there is a meeting so that I can attend the meetings, and then we meet quarterly in the evening. So that's usually that's a huge honor for me. It really is. It's a privilege. It's a privilege because I believe in this hospital. I really do, and I want what's best for it.
Right. Well, and you've seen a lot of growth and changes since it was 89 or 84, you said?
86, yeah.
86, well, somewhere in between. So you've seen a lot of growth, both in the hospital and in our community, too. Kingman's grown a lot in the last 21 years.
We just want some more restaurants.
Yes, well, we'll work on that.
It'd be nice.
But it's, you know, what do you think is the best thing that you've seen in the growth here?
I think the foresight and the vision of this administration, and I say that very freely, recognizing the needs in this community and providing them and seeing that they happen. We have the breast imaging center. I mean, that's huge. We have a specific person that does that. We have the cancer center. We have the wound care center. I mean, most hospitals don't have these facilities, and we have it all here. We have it all here, and I just I feel, you know, I hope never to have the need, but if I do, I know that I will be well cared for. Right. You know,
well, we had Dr. Donovan Schmidt on the show a couple of weeks ago, and he was talking about it, and I was saying how it says a lot right there. If a doctor knows that he has choices and knows what his options are, and he chooses to stay here, that's pretty cool. You know, and like you said for yourself too, when you know how good the care is and the people are, that you're going to get that top quality care. You know, that's pretty exciting.
It's a trust and rapport factor that's really a big deal.
And that plays a lot into your recovery.
Oh yes, it
does. You know, because it's not just physical; it's the
peace
mental
of mind.
side. Yep, absolutely.
I think there's more to be said for that. Almost, not quite, but we have to have the expertise and the knowledge and the technical ability to take care of our patients. But their mindset really matters too. That's why we always try to try to get them into a positive frame of mind as we go in. You know, it won't be anything like you expected it to be, and it will be okay. And when we're finished, we always ask them, "Wasn't so bad, was it?" No, I would say at least 95% of our patients say it was not as bad as I thought it would be.
Excellent. Well, I've got a few other questions I want to ask you about, but we've got a couple of messages here, so stay around. We'll be right back after these messages.